Welcome to the 11th episode of the Lebanese Physicians Podcast. And today we have Dr. Fouad Chebib. Dr. Chebib is a consultant of nephrology at the Mayo Clinic in Rochester, Minnesota. And he is specialized in polycystic kidney disease particularly. The reason I'm inviting him right now is because he has a great initiative right now to provide dialysis machines that are much needed currently in Lebanon. And we will be discussing more about that today. Welcome, Dr. Chebib.
Thank you, Dr. Diab, for having me.
Of course. So can you briefly tell us about yourself, your connection to Lebanon, and your journey over here to the US, and how you ended up at the Mayo Clinic?
Yeah, absolutely. I'm from Lebanon, originally from Zahri. I finished my high school, and actually I tried to come to the United States for a medical school, even when I was right from high school. But that was a difficult task, given that international international graduates are a little bit hard to get into medical school. So I went through the usual. So I went through the pre-med at AUB, and then I did my medical school at Lebanon University. So graduated in 2008, and then knowing that I want to do my training and career in the United States, I decided to move right after the medical school and did 2 years of research as postdoctoral fellowship at Beth Israel Deaconess. And so that was in molecular nephrology, with the intent that my interest is in polycystic kidney disease. And then I stayed in Boston at St. Elizabeth Medical Center for my internal medicine training, and then that helped me to get into the fellowship I wanted, which is at Mayo Clinic. And the reason why I chose Mayo Clinic was mostly because of my connection to polycystic kidney disease. So a lot of you know that my father has polycystic kidney disease, so that inspired me to find kind of a better either a cure or better treatments for polycystic kidney disease, so patients don't have to be on dialysis. So I did my fellowship, and then I stayed on as staff. So I did an additional 2 years of research through a Mayo, what's called Mayo Scholar, with specialty in calcium signaling and cyclic-AMP signaling. So more of basic science and translational research in polycystic kidney disease.
Great, that is great work. Hopefully we'll find a good cure soon for the disease. And I know right now that you are involved in an initiative to bring dialysis machines to Lebanon. Can you tell us more about what's going on in Lebanon right now in terms of dialysis situation? Are all patients able to access dialysis in the country, or have there been problems with access to dialysis given the COVID-19 and economic situation in the country at this point?
So I've been, given my family is still in Lebanon and I visit frequently, and I know all the nephrologists, I've been aware of the situation of the Lebanese patients. So let's divide that into two categories. One is the acute need for the acute dialysis, or need for acute dialysis, and then the chronic dialysis treatment. So for the acute need for dialysis, such as in patients in the intensive care units, they are hypotensive, in shock, and they need dialysis. Most of those patients don't have access to what we have here in the United States or in Europe, which is the continuous renal replacement therapy. So when someone is very sick on multiple pressors, they cannot tolerate the traditional hemodialysis for 3 to 4 hours. They need what we call the CRRT, or the continuous renal replacement therapy. So in fact, only 2 medical centers in Lebanon have those machines, and all the others don't. And typically those patients would not tolerate the intermittent hemodialysis in the other centers, and they would actually die just because of inability to dialyze and due to the lack of the proper resources. Despite that, the nephrologists are very well trained, and they have the expertise, they just need the resources. And this was actually, I wasn't aware of that, despite knowing the nephrology world and the Lebanese nephrologists. And this came to my attention when my father was very, very sick, and he needed that modality of renal replacement therapy. And with the help of a lot of people, we were able to get it to him. And he was the first patient who jump-started the program with the help of the nephrologist there. And he was the first patient to be on that treatment through a demo machine, a demonstration machine that would move from one center to the other. So it actually took 72 hours of nonstop calls to get it, to make it happen. It almost felt like a mission impossible, to be honest with you. And it's very difficult to, if one of our loved ones would need such a treatment, it's very hard to get it. And then when someone is very sick, you can't transfer him just to that medical center. So what I did is I tried to have, my father passed away, unfortunately, but now we're trying to help the others who are going through this situation to be able to access these resources or these dialysis machines. So we launched the initiative of funding at least 10 CRT machines, and then divide and distribute them to the academic medical centers in Lebanon. So far, so the goal is 200,000 to buy 10 machines, and so far we have about 63, and more people are pledging to donate. So hopefully we can reach the goal. So this is kind of the need for the acute dialysis. Now, the other part, which is also very, very critical, is the need for or the resources for chronic hemodialysis. So there's about 4,500 to 5,000 patients who have end-stage kidney disease. So kidney failure, they need 3 times a week dialysis, each time 3 to 4 hours. They would go to a dialysis center and they need that hemodialysis. So Lebanon was one of the first countries to actually have a universal coverage for these patients through the Ministry of Health. And that's really pioneering of the Lebanese health and the Lebanese coverage, right? So even in many other countries right now in the world, people have to pay either from their insurance or out of pocket to be able to dialyze. So this was, up till now, this has been kind of very good for all the Lebanese patients, and to be able to go to a dialysis center and then be covered by the Ministry of Health. But now, due to the economic situation, and a lot of, despite having the machines, the regular dialysis machines and the centers, there's a lot of difficulty in getting the filters and the one-time use consumables, if you may say. So this, with the exchange rate differences and the inability to import these medical necessities, the dialysis centers are not able to cover, to maintain and sustain the ability to dialyze these patients. So the first step that currently just happened a few days ago is that the insurer or the insurers have increased the reimbursement, but this is not going to solve the problem, because it's expected that the exchange rate is going to potentially keep going up, hopefully not. But this is going to continue to remain a problem because the dialysis centers won't be able to afford continuing dialysis for the current patients. And a lot of dialysis centers are facing a problem of potentially not accepting new patients. So although right now we have 4,500 to 5,000 patients, but in the future, let's say next month, you have 5 new patients that need dialysis, there might be a concern that these dialysis centers won't be able to accept, because they cannot continue to pay the nurses, the technicians, getting the need for the equipment, maintaining the equipment. So we might be facing a crisis. Hopefully not. So similar to the first initiative, we're kind of anticipating these problems, and in 2021, no one should be facing the problem of saying, okay, we're not going to dialyze you 3 times a week. We're just going to do twice a week. That's not acceptable. It's not acceptable for someone, let's say a friend, a family member, who needs dialysis, and they have to go and pay out of pocket, and they don't have it's expensive because it's a lifelong, 3 times a week. It's not only one treatment. So no one would be able to really afford paying out of pocket the dialysis treatment. So we have to find a solution. The main solution is through the government, of course, but as I always say, if there's a problem and the government is not there, the mujtama al-madani, the civil society, should step in. We should. So I'm kind of right now thinking of another initiative or another actually non-profit organization that would take care of chronic dialysis patients, but also other patients who are really needing the resources to maintain just the basics for medications uh, and so forth. And even a lot of patients worry about their future. So that's really very stressful in a year of pandemic. So on top of the pandemic, the risk of COVID and their high risk of mortality, now they have to worry if they're going to be able to stay on dialysis or not. And they all understand that once you stop dialysis or if you decrease your dialysis sessions, you're not gonna do well.
Right. And I agree with you on the CRRT machines. I mean, when I was working there in one of the major academic medical centers in Beirut, we did not have access to a CRRT machine, and actually everybody was on hemodialysis and not on CRRT for various reasons, some of which you have discussed yourself right now. So that right now your initiative is mainly to try to get the 10 CRRT machines, and then you will work on the other initiative of trying to get the equipment needed to maintain outpatient dialysis for the patients, right?
Exactly. The other one is more of a long-term and anticipated kind of needs, and hopefully it would be a non-profit, so it's easier to get bigger donations from Lebanese and non-Lebanese living in the United States because that would be kind of tax deductible and so forth. And hopefully we kind of get bigger funds, and then we'll have people on the ground through the Lebanese Society of Nephrology and other physicians who are willing to help to kind of decide who's really the patient in need and then just provide them what they need. So.
And right now, how I know you've reached about maybe, would you say 35% of your target approximately?
Yes, so about that's right, and about 3 machines. So hoping for at least a fourth machine. I know, uh, I mean, the donations were from anywhere from $5 to $5,000, and many of the Lebanese physicians actually living in the States or abroad, and a lot of them are also nephrologists, and they understand the importance of CRT, so they were very, very generous in their donations. So hoping to get even to the 200,000. So I'm reaching personally to everybody, and a lot of people love Lebanon, even if they're not Lebanese, and they understand the need. But particularly Lebanese doctors that they want to pay forward for uh, with these initiatives, but also they want to take care of their family. So it doesn't have to be someone with chronic kidney disease or someone with end-stage kidney disease. It could be anybody who, unfortunately, if they get COVID, they get kidney failure, if they get through cardiac surgery, and believe it or not, there's a lot of people who lost their loved ones just from that, and I've heard at least 10 stories on how they lost their loved ones because they couldn't get the machine. So we should, I mean, that's just kind of a mission oriented one-time thing, and hopefully we can build on that. And it's kind of very practical, and we get the machine, we're gonna see it in those hospitals, and then all the money from all the money, 100% is going to go towards the mission, and there's not kind of any percentage usually in big organizations, as overhead. There's no overhead. It's just me buying the machines, and it goes directly to the end consumers.
Right, so that's a good thing. So basically, zero administrative fees and 100% of the donations goes towards buying the machines. And then potentially, I'm sure you will need money to help with maintenance of the machines afterwards, right?
Sure. So within the purchase, the first year is the maintenance is within the purchase, so it's covered by the company. And the reason why we're choosing this company because they have a good presence in Lebanon, they have a good customer service, and they're engineers. So personally, when they were troubleshooting the machine, the engineers came and fixed it right away. Their technologists would train the nurses, and they're kind of hands-on, and probably will do more seminars, and more people would to train the nurses, and the physicians don't need any training. A lot of them are trained in the US, and the Lebanese Society of Nephrology is also hands-on in helping. It's amazing how it's very collegial how they try to help the programs to build up their programs and help the patients. So which is very nice in Lebanon. Everybody knows each other. So
have you delivered any machines yet? You have, you said, right?
Not yet. So I have three secured funds so far. So I was debating if we should wait until the goal is reached or just start. Probably I would just start hoping to get the four machines and then maybe we'll deliver the first batch. But I am in touch with the company and trying to also negotiate the price because I want the lowest price possible. So if we get a little bit more, then we can negotiate maybe better too.
Basically, you're buying them and delivering them to the hospitals, right?
Yeah.
Or yeah.
So I'm buying them directly from the company, and then through the Lebanese Society of Nephrology, we try to figure out which academic centers are able to start the program. There's always this concern that would the patient be able to afford even just the filter of the CRRT machine? It's about $200 or so, and it lasts 48 to 72 hours. So there's always the concern that $200 now it's becoming a big deal in Lebanon, unfortunately. And then yeah, so hopefully if we get maybe like a fraction of the some like additional money that we cannot buy a full machine, maybe we'll buy more filters also so we can help with that. And there's also the replacement fluids. They're actually locally manufactured. They're not that expensive. So hopefully that shouldn't be a hurdle in terms of the logistics to maintain and continue and offer the treatment.
And to give an example, I think just for people to hear it, I think one example of people who may need the machine is what's happening now in Lebanon now. COVID is rampant, and you get a significantly sick COVID patient with low blood pressures from the infection and with kidney failure that needs to be dialyzed, and potentially putting them on regular hemodialysis. You have to pull fluid out very quickly, and they will not be able to tolerate that, and therefore you will not be able to dialyze them adequately, and therefore you would need this machine to try to dialyze them slowly and keep their blood pressure in check as you are doing that. In the absence of this machine, this patient may not be able to tolerate to be dialyzed and may pass away due to the absence of machines like this.
Exactly. And in fact, the way how it goes, which is a little bit traumatic to the family and to the patient if he's awake or she's awake, that they actually the family or the patient have to sign that if they are on the regular dialysis machine, if if they get cardiac arrest, it's kind of their responsibility. I mean, they're kind of this is a last resort, and it's not safe. But then if it's not safe, but then if you don't do it, you're gonna die anyway. A lot of times, the family has to sign an agreement that this is done under kind of this agreement that it's a last resort type thing, which is very traumatic.
What is your website for people to donate? I'll for sure I'll write it down next to the podcast, but if you can say it to us too, that'd be good.
Sure. So it's a GoFundMe, and it has a lot of kind of random letters and numbers. But I did the tinyurl.com. So if you type tinyurl.com/Kilna Lebanon, so KILNA-LEBNEN. So it would direct you to that. Or if you Google GoFundMe and my name Fouad Chebib, or you can do GoFundMe and then CRRT initiative or CRT Lebanon, it should come up. And that's all on my social media thing. So I've been kind of it's my way of healing actually. So my father passed away and I wasn't able to be there due to various reasons. So this was a way of kind of in his memory and just for kind of channeling that pain into a good cause. So if you have me on social media or if you like to add me, I'll be happy to send the link to.
Yes, I will do that. And I mean, this is a great work. I think you are trying to improve things in the country right now. And I mean, as people, I think as most people know, that the situation right now is not very good in the country in terms of the availability of dollars to import equipment. And this is leading to a decreased availability of a lot of equipment. So I think initiatives like yours are going to be needed more and more in the future to try to maintain some level of supplies and good care to the patients over there. So thank you for your initiative, and I think just keep us updated once you deliver your first machine to get some stories of patients who have benefited from it over there.
Absolutely, yeah. More pictures and more stories, hopefully, just kind of to lift up the mood as well. I mean, a lot of bad stories are on social media all the time with COVID. So hopefully we can brighten up the mood with more initiatives.
Hopefully, this is a good story of collaboration between nephrologists in the US and nephrologists in Lebanon, the Lebanese Society of Nephrology over there, which can be built upon with other societies in Lebanon to improve the situation there.
Absolutely. Yeah.
All right. Thank you very much.
All right. Thank you.